I didn't hear a lot in the presentation of, plans to bring employees back after the COVID pandemic subsides. Did you hear any of that?
I didn't hear much at all. And I think in a way it's an issue that's already been decided, Bill. I think not only in healthcare, but in industry, there's an acknowledgement that it's not going to be 100% remote in the future, but it certainly will never be 100% in office. And so the idea of what is an office and how do people work has been changed forever. So I kind of viewed that as just something that's been accepted by everybody. I'll jump into the financials if you want, because I thought there were some very interesting things there. And I always go back to our initial discussion last year when COVID was breaking and some of the predictions that we made. And one that's held true is around the balance sheets and the kind of overall financial health of these large systems. And I think the takeaway was all of them from a balance sheet standpoint, from a liquidity standpoint, they're all still in very good shape. They've taken steps around moderating CapEx. So all of them really, many put a freeze on CapEx or moderated new projects or building. And so they throttled back on CapEx. There were borrowings. So really kind of shoring up the balance sheet from a line of credit standpoint, the Medicare advance payments. And then one thing we got wrong last year was I had forecast that equity portfolios would take years to return. And we've seen that's already happened. So I'm still not sure I understand why, but like all of us, I enjoy the fact that the equity markets came back. So all those things together led to real stability in the balance sheets of these systems. Where it got interesting, and I know you want to talk a little bit about risk and value-based care, but let me talk about the income statements for a while, because the income statements were as you would agree, Bill, absolutely brutal. And all of them were really improved by the CARES Act funding. And so those results were all embedded in the results that were presented. But even with those CARES Act funds being recognized, almost all the systems had operating margin losses, or I know all of them had significant degradation from the prior year. So, and that's really when I read or see any financial report from a health system, I immediately go to the CARES Act funding and I pull that out, because what you're trying to really understand is what I call the annuity earnings of the organization. So CARES Act funding is one time, or it may be two times if there's another round of funding approved, but this certainly won't be an ongoing method or means of support for health systems years into the future. So you've got to pull that CARES Act funding out to see where you really stand from a true volume / revenue less expense standpoint. So all of them were, I think, showing very difficult results. Some were forecasting a return in volumes in the second half of the year, and some even a return to profitability in 21. I don't see that, and I think that's going to be really a tough putt. But others were forecasting no return to profitability ex-CARES Act until 22, or some of them were even saying 2023, which I think is a more realistic estimate.